one word that confuses patients and families more than almost any other in cancer care, even when we try to explain it carefully. That word is palliative. When a doctor says the disease is advanced and cure is no longer possible, what they're really saying is that the goal of care has changed. It does not mean nothing can be done, it means we're choosing to focus on something different. Palliative care is about quality of life. In practical terms, it is symptom focused care. Pain, breathlessness, nausea, anxiety, sleep, fatigue. It is comprehensive care for people living with serious illness. And that matters because while hoping for cure is natural, there comes a point where what helps most is realistic hope. Not pretending the situation is different than it is, but asking how to live as well as possible within it. I once heard an analogy that explains this well. Imagine you're on a plane and one of the engines fails. You know the situation is serious, you don't pretend everything is fine. The goal now is a controlled landing, not a crash. That's what palliative care is about. In the past, palliative care was introduced very late, often only when all options felt exhausted. That has changed. Today, in advanced cancer, palliative care is meant to begin early, sometimes from the first visit. One thing I often tell patients and families is to stay connected to a doctor closer to home, a physician in a nearby hospital. Hospitals are far more likely to help when they already know you, when they understand your diagnosis, what treatment you've had, what kind of support you've needed. The worst situation is arriving for the first time during a crisis. You have access to good home care nursing too. As illness progresses, there may be moments when hard decisions come up: ICU admission, ventilation, dialysis, other invasive measures. The question to ask is simple: are we helping the patient or are we prolonging suffering? Palliative care helps families think about this before panic takes over. Early palliative care improves symptom control, clarifies goals, reduces unnecessary hospital admissions, and in some cancers, it even improves survival. Palliative care is not end of life care, it is serious illness care. And the earlier it begins, the better patients and families tend to do.